If you have an L4-L5 disc bulge and you've been doing home exercises, stretches, and everything you were told, yet the pain keeps coming back, this isn't because you did anything wrong. I'm going to show you why home exercise programs often fail when disc injuries become mechanical and neurological, and how patients improve once care is specific and guided. One of those patients was Ted, nearly 60 years old, dealing with severe leg pain that controlled his daily life until we address what was actually happening at the disc and nerve level. So in this video, I'm going to give you clarity about L4-L5 disc bulge treatments. You'll understand when home exercises stop being enough, why your MRI may explain the problem but not the solution, and what professional care should actually look like before surgery ever becomes part of the conversation. I'm going to walk you through our exact 8-step process I use to decide when to escalate care safely without rushing, without guessing, or masking pain while damage continues. This is why Cornerstone Pain and Wellness has over 500 5-star reviews. Our entire team is dedicated to ensure that no one who comes through our doors leaves without a plan to not just feel better, but to heal, to avoid more drugs and surgeries, give hope and encouragement, and ensure our patients don't just get back to normal, but even better than before. By the end, you'll know exactly where you are in the process, what you should stop trying to manage alone, and how to move forward with a structured treatment instead of uncertainty. Hi, I'm Dr. Paul Barnwell, a chiropractor in Katy, Texas. For more than 10 years, I've helped people get out of pain and return to the life that they want using natural care instead of drugs and surgery. My mission is to help people understand their bodies and build long-term health so they can live with confidence and purpose. If you're dealing with chronic pain, failed treatments, repeated flare-ups or surgery, being recommended without a real plan, this channel is for you. You deserve clear answers, not quick fixes. In this channel, you'll learn what is actually happening inside your body, what actually helps it heal, and the information most people never hear in a routine doctor's appointment. Subscribe if you want to understand your body better, reclaim your health, and get practical steps you can use right away to move toward a life with less pain and more purpose. I upload a video every week. Let's get started. If your MRI says L4-L5 or L5-S1 disc bulge, the most confusing part is not the disc injury. It's what you're led to believe that sentence means. Most people read the report, see words like bulge or degeneration, and instantly assume two things. First, this explains all of their pain. Second, this is their future. And once that belief sets in, everything they try is filtered through fear and confusion instead of strategy. Before anyone touches your spine, the most important thing that should happen is listening. Not a quick intake form, not a rushed conversation, real listening. Because disc problems do not exist in isolation. They exist inside of your daily life. This step looks at how you actually live and move. How much you sit. Are you a desk worker? How much you travel? What your work demands are. What activities trigger symptoms and which ones calm things down. It also looks at what you've already tried and, more importantly, what's failed. That history explains why repeating the same advice has not worked. We also look beyond the spine. Prior injuries, even ones that seem unrelated, they matter. Hip stiffness, old knee injuries, ankle issues, weight changes, blood sugar issues, inflammation, these all play a role. These factors affect how nerves heal and how discs tolerate stress. Ignoring them create blind spots that an exercise program just can't fix. This step alone often explains why people feel dismissed elsewhere. They were treated like a diagnosis instead of a person. When a full picture is understood, then the picture becomes very clear and the next steps can be had then. Step 2 is hands-on functional examination. Once the history is clear, the next step is to see how the body is actually functioning. This is where listening turns into testing. Because what someone feels and what their body is doing is not always the same thing. This exam is not about chasing pain. It's about finding the primary problem. We look at which disc level is truly involved and which areas are just compensating. We separate muscle guarding from real instability, and both are important. We assess how the hips, how the knees, how the ankles are contributing to the stress at the low back. This matters because a disc rarely fails on its own. This step is exactly where things started to make sense for Ted, the patient I'll talk about later. His MRI showed a disc bulge, but the exam revealed why his symptoms never settled. His hips were restricted, his muscles were guarding, and his spine was absorbing load the wrong way. Until that was identified, nothing else had a chance to work. This is also why pain can persist even when an MRI doesn't look that bad. If movement is poor or load is being absorbed in the wrong place, the disc stays irritated no matter how many exercises you do. Once we understand how the body is moving, the next question becomes how the spine handles load under gravity. And that requires imaging done the right way. Step 3 is standing and motion-based x-rays. Once movement patterns are understood, the next question is simple. How does the spine behave when it's actually supporting your body? This is something a table exam alone can't answer. This is where standing and motion-based x-rays matter. These images show the spine under load, not lying down or relaxed. That's important. We look at how the lumbar spine stacks, how segments shift, and how pressure is distributed when gravity is involved. Lateral bending views in a full spine context often reveal problems that static images alone, they completely miss. This step helps explain why someone can have a normal looking MRI but still feel unstable, or why symptoms change depending on posture or something you're doing, some activity. It shows disc loading patterns, alignment issues, and stress points exercises can't correct on their own. Step 4 is the MRI correlation. Once we understand how the spine moves and carries load, the next step is to look at the disc and the nerve tissues directly. This is where MRI belongs in the process, not at the beginning and never by itself. MRI helps to confirm disc involvement, nerve root proximity or how close it is to the spine, and tissue changes like degeneration or inflammation, arthritis, but it doesn't explain why the disc is stressed or why symptoms persist. This only makes sense when MRI findings are matched with the exam and the x-rays. Step 5 is specific chiropractic adjustments. Treatment can now finally be specific since assessment is complete. This is where we address the mechanical part of the problem, not low back pain in general, but how a particular disc is surrounding joints and behaving. These adjustments are based on a disc-centered analysis. The goal is to improve joint mechanics, reduce abnormal pressure on the disc, and improve nerve signaling. It's not about force, it's about precision. Skill matters, specificity matters. Chiropractic adjustments for the L4-L5 disc bulge patients are gentle and they're safe. When the right segment starts moving better, the disc often becomes less irritated and symptoms begin to calm down. In fact, for most of our patients, they feel an immediate difference. They feel so much better. Not only do they feel an immediate change, but they sleep better. It's really life-changing for them. It's amazing what we get to do every day, especially those who have tried exercises, medication, or even injections without any lasting relief. And that's because the underlying issue, the mechanics, were never addressed. Now, sometimes adjustments alone aren't enough when the disc is under a lot of pressure for a long time. So to reduce stress, we need to change the load environment, and that's where the next step comes in. So step 6 is non-surgical spinal decompression. If a disc that's been under pressure for weeks or months, improving motion is only part of the solution. The disc itself also needs relief. This is where targeted spinal decompression comes in. With decompression, it's used to reduce the pressure inside the disc. It literally rehydrates the disc. It decreases tension on the nerve. Most people feel like they can stand taller. They feel like there's just a weight or gravity that's taken off of their spine. It creates an environment where healing can actually occur. This is why it works best with specific chiropractic adjustments. So step 7 is supportive treatments. Once disc pressure and nerve tension are reduced, the next goal is to support healing and restore normal movement. These may differ from case to case. It might be different in your case. Oftentimes we'll use things like laser therapy, for example, which is used to reduce pain, inflammation, and it supports tissue healing. It works really well. Sometimes we'll use shockwave therapy, which helps to restore mobility in muscles. It reduces adhesions and scar tissue that's built up. And oftentimes it gives incredible pain relief pretty early on. We also utilize specific soft tissue techniques and fascial work to help release tension that keeps pulling the spine back into pain and retrains the muscles to hold properly. You know, your nerves control the muscles. They're the master control system. And when under distress, they act like a governor in your car does. They limit speed and power. And so we turn them back on so that you can feel stronger and more confident. Now, none of these are add-ons. They're tools that are used at the right moment to help you get better faster. And when they're timed correctly, they allow the spine to hold the gains made from the adjustments and the decompression. So once the spine is moving better and inflammation is under control, the final piece is teaching the body how to maintain those improvements outside the office. That's where the home care finally makes sense. Okay, and the final step is home care, supplements, and lifestyle. This is where exercise belongs in the process, not at the beginning and not all at once. Home care is introduced progressively. Patients are guided on when to brace, when to use ice or heat, and how to recover between visits. Supplements and anti-inflammatory support are considered when healing needs help. Oftentimes, if you're overweight, if your BMI is too high, if you have diabetes, that's going to complicate the process, and so we want to address that as well for the best healing possible. Other things like your lifestyle factors, so what do you do for a living? Are you sitting at a desk all day? What does your ergonomics look like? We want to know what that is so that we don't keep going backwards. And the goal is not to give you a long list of exercises. I already know patients don't like that. So we want to take it progressively and just give you the most effective ones, and then we measure it as we go so that we can change the frequency, the cadence of the exercises, the type of exercises that you get to make sure that we're targeting the specific areas and not just giving you a gym routine. Once all of these pieces are in place, then the momentum starts rolling and you start feeling better and better and better. In fact, most people with these types of disc issues, again, it's case by case, they gain a lot of improvement early on, and then it's a slower process after that. So it's like we get the low-hanging fruit taken care of, and then after that it's a little bit slower, and that's the stabilization process, which is where we're really rebuilding the structure that created the problem to begin with. And that's where healing really begins. And this process is not theoretical. It's exactly what patients go through. And one of those patients is Ted. This is one I was talking about earlier. Ted's nearly 60 years old when he came in with an MRI confirmed L4-L5 disc bulge. His leg pain reached a 9 out of 10 at times, where 10's the worst. Sitting was difficult, travel was exhausting. He's got a young daughter, which had become stressful instead of enjoyable. And he already tried the medication route. He did the epidural steroid injections, and the relief was there, but it never lasted. And it makes sense now, right? It never got to the underlying problem. So once we went through the full assessment process, the real problem became clear. His disc was involved, but it was not the whole story. He also had significant hip restriction, muscle guarding, inflammatory overload that kept that nerve irritated. So even while he was out of pain after having epidural steroid injections, it just became worse because the pain wasn't taken care of. And his plan, just like we discussed, included all of the things that we just spoke about. Specific chiropractic adjustments, realigning that vertebrae on the disc to make sure it's taking pressure off of the nerve, specific spinal decompression, rehydrating the disc. We did laser therapy to reduce the inflammation, shockwave to reduce the pain, and reduce the muscle guarding. Shortly after that, he noticed that the pain started to subside. It wasn't gone right away, but it started to subside. He could stand a little better. And then we find out, he's doing things in life that he wouldn't normally do, like climbing ladders and playing with his kiddo. Didn't even realize that the pain was starting to subside and the function was improving. And that's usually how it goes with patients. They don't even realize that they're feeling so much better that they're starting to regain that quality of life. We continue that process until they feel amazing and they get life change. So not only can he do the things that he wanted to do before, but now he's looking forward to doing things that he couldn't do before that because the function has improved so much. And that's why it's so important to have a properly structured plan of action to make sure that we're not just addressing the pain, but we're addressing the underlying problem, so you're not just stuck on drugs and surgery and this rigmarole of the medical system. So if you're watching this and wondering whether exercises or home care is still enough, there's a few signs to pay attention to. If relief is always temporary, if flare-ups keep returning, if the leg pain, the numbness, the weakness is part of the picture, those are signals that guessing is no longer the right strategy. Proper care should never feel rushed. It should not ignore imaging. It shouldn't force movement through pain or mask symptoms while the damage continues. And it should never be a single treatment offered to everyone. What you want is a process that starts with understanding, progressing with you as you respond. It's about doing the right thing at the right time. And for many people, the most important step is simply knowing when it is time to stop managing this alone and start getting help. You now have a clearer framework that might finally help you make sense of your disc injury and see a way forward. Many people feel stuck, frustrated, or worried about what their MRI means, but healing is still possible. When care is timed correctly and guided with precision, the body often responds better than people expect. If you found value in this video, like it and share it with someone who feels stuck or confused about their injury, their MRI, or their pain. It could help them see their situation differently. Now it's your turn. What treatments have you tried to help your disc injury? What's worked for you and what hasn't? Share your experience in the comments. I read and reply to every comment. Remember to subscribe if you want to understand your body better, reclaim your health, and get practical steps you can use right away to move toward a life with less pain and more purpose. I upload a new video every week. The next video you should watch is this one. L4-L5 disc bulge, the 5 exercises I teach every patient for lasting relief. Go and watch this video next. I'll see you next time.